Good afternoon, good evening, everybody, and welcome to our session this evening on the history of medicine and nursing series here being hosted here by the Royal College of Surgeons Bahrain. I'm Maura Pigeon and I am your moderator for this evening's session, and it's a great honour and indeed pleasure to moderate the session this evening on nursing pioneers in Bahrain, in the first hospital established here in Bahrain, which is the American Mission Hospital. There will be a question and answer session at the end of the presenters' talk, and I would ask you to pop your questions into the Q&A chat box. Our functions there on the top of the screen. So with those housekeeping arrangements now stated, again, I would like to just remind you or invite you to our seminar and introduce our speaker today, who is Ms. Elise Dabad. Elise Dabad is the Executive Director of Nursing at the American Mission Hospital here in Bahrain and has been in the position since 2017. Prior to this, Elise has a distinguished career in nursing management, having been in Saudi Arabia, in several hospitals in Saudi Arabia, and also in Benghazi in Libya. Elise hails from South Africa, and where she did her nursing education and training, and worked in developed and built up a portfolio of clinical experience in surgical and community nursing before embarking on her international endeavours in the Middle East. And so it gives me great pleasure to welcome Elise, the Director of Nursing at the American Mission Hospital, and to congratulate Elise, who has successfully completed her MBA and MSc here very, very recently. And she's just shared with me her thesis is on developments and changes rather in the nursing workforce, which of course is exceptionally important to this day. So Elise, the floor is yours, or the virtual floor is yours. And we shall begin our presentation, which will be for about 40 minutes. After the presentation, as I say, we shall have a question and answer series. So thank you again, Elise, and to all of you for attending this afternoon.
Okay, thank you, Maura, for the nice introduction, and welcome all of you online. It's my pleasure today to present the nursing pioneers of Bahrain, the first hospital, and their contribution to the growth of nursing. So before I start, I just want to give a little bit of a history of our hospital. As the first modern hospital in Bahrain, but not in all the GCC countries, the American Mission Hospital continues to impact the people of Bahrain with its attitude of service and community. We are really into the community and serving the people. The hospital itself is a non-for-profit organization, which means there are no stakeholders who seek, earn or get profits from the hospital. Supplies, if any, but all that we get, we put back into the infrastructure and into the operations. My presentation today tells you about this 120-year-old hospital, his legacy, and that has been serving Bahrain since 1903 and even earlier. I shall be focusing on the hospital's founding and also on a few stories of the pioneering of nurses. As we were celebrating Nurses Week last week and even today in AMH, and then now how the nursing pioneers had impacted the profession of nursing in this country. But before I began telling you this amazing history, there are a few points for you to remember as I speak. Government healthcare services become better in Bahrain after oil was found in Bahrain, which was in 1932. after Bahrain, Saudi Arabia and Kuwait struck oil in 1930s, the other GCC countries also found. In Bahrain, Naim Hospital was built in 1940 and the Salmania Hospital was built in the 1950s. But the American Mission Hospital already existed for 40 years before that. So that is why my presentation today will be about history. The objectives of my presentation is to aim to the audience an introduction of the first hospital in Bahrain and its earliest doctors and nurses. A few stories of nursing pioneers who served here will be shared with you, and a view on how nurses impact the profession of nurses. The outline today of today's presentation will be the introduction, then information about the first modern hospital. That will give us a little bit of a background of AMH and the history. The earlier doctors that served in AMH, and then I will discuss a few nursing pioneers from Amy Wilkes-Zwimmer, Elizabeth de Pree, Jane Scarfield, Josephine van Peersum, Cornelie Dallenberg, Fatima, our first Bahraini nurse, and also Ida Patterson. She's got a very interesting story behind her, and also the impact of nurses on our profession, and then we will have a conclusion. To give a brief information about how the Arabian mission actually started. This happened in 1988 when 3 students that was attending Dr. Lansing's classes in the Theological Seminary of the Dutch Reformed Church in New Jersey, USA. They did not know anything about the mission, and they also didn't know at that point in time how soon they will have an influence of the growth of the modern healthcare and the education across the sands of Arabia. James Canteen, if you can see one of the pictures, Samuel Zwimmer and Philip Fels had the first meeting as a discussion in October 1888 that was inspired by their Professor John Lansing, who worked in Syria and Egypt as a missionary. They got so encouraged about the stories that was told by him that they decided that they will serve Arabia. Nevertheless, they were called the wheel with the 3 spokes. They decided that they will connect to the hub with Dr. Lansing, and then they will go to come to Arabia to participate in the mission. Samuel Zwimmer and James Canteen was the only ones to set sail to teach and serve in the Arabian Gulf and southern Iraq. But before they joined, they learned the basic Arabic so that they can be able to communicate with the people. Armed with knowledge of Arabic, learned from Lansing's Arabic classes and additional classes that they attend in Beirut, Lebanon, they were filled with a desire to come and do their best. The 2 of them came to Arabia, but they served in different parts. Much later, the other doctors has joined them, and we will also discuss with some few of the doctors that came and joined the missionaries. Okay, Samuel Zwimmer was one of the missionaries that came by ship to the shores of Bahrain. He arrived on the 7th December 1892. But for this missionary doctor from the US, it was not the first time that he came to Arabia. He was on the port up and down. He visited Bahrain, but he never actually came to work in Bahrain. Traveling to and from Basra and Iraq on his stopover, he was so mesmerized about the captivating beauty of the island and the people, and he decided to stay here to serve the people. Thanks to the welcoming nature of the people in Manama and the beautiful walkways that was there that time and the gardens, he soon built a relationship with a postmaster that was mentioned, Gonzalez, that made up his mind to find a room to rent and to bustling the souk of Manama and to serve the people. He was the first physician that started a dispensary and a bookshop in Manama souk. where he used to distribute books and also give medical advices and medical advice to the patients. Many patients, as you can imagine, many patients came to see this new USA doctor in Bahrain. They came to visit the bookshop to exchange books, and also they got medical treatment instead. So in one day in February 1983, he was so overwhelmed because in his journey, he saw 211 patients that day, and he did 11 minor surgeries. And he realized that he will not be able to cope by himself. He needed help. So he was calling the Dutch Reformed Mission in USA and asked for them to send them some help to Bahrain, because he was really in dire straits and the people of Bahrain needed all this information. So soon he requested new doctors to the Arabian mission, and trained doctors arrived. So now I'm going to talk about the first hospital that was in Bahrain. So the first hospital actually was started, a young couple, a doctor and his wife, Dr. Sharon Toms and Marian Wells Toms, graduated in medicine in Michigan University in the USA, and then they came as a couple to Bahrain. They went through all the places in Muharraq. They actually, Dr. Toms was so impressed about the food and the cuisine that they served here in Manama. Then they met the Sheikh Isa bin Ali Khalifa, the ruler of Bahrain at that point in time in 1901. And they requested some land from him. So they promised to purchase land, and he gave this as a generous contribution for them for this Mason family. And the Mason Memorial Hospital was built. And if we look at the pictures, I will show you a little bit of pictures. You can still see some of the remains is still here today, but maybe people will not really realize if they look at the picture. So that hospital was formally opened on the 26th of January 1903, and it was named the Marius Wells Toms Hospital for Mothers and Children. But within the next 2.5 decades, this hospital grew so rapidly, and the need for a separate wing for mother and children was so acute that another hospital was required, that was opened in 1927. And a memory of this first American lady physician, Dr. Marian Toms, that died of typhoid in 1905. The hospital was named after her, and the hospital became the Marian Wells Toms Hospital for Women and Children. So this is a picture of the Mason Memorial Hospital that was opened in 26 January 1903. And if you look at the picture, you can still see part of the clock tower, or that was the church now. And the road next to the open wall is the cemetery actually from today. So some of the early, I'm going to talk about the earlier doctors. So I already discussed Sharon Toms and Marian Wells Toms. So this is a picture of them. They were the first doctors after Dr. Samuel Zwimmer that came to Bahrain. So they came to Bahrain in 1900s, and they were a couple. They were a pair, and they. The next doctor that also joined them was Charles Stanton, appointed in 1906. Now, if we will look at one of these pictures, this is the there was an operation going on in the courtyard of the mission house in 1900. In this picture, we can see Sharon Toms and the other staff in the operating room of the Mason Memorial Hospital in 1904. If you look at the picture, you can see that already there, you know, the effect of the operating room and the setting was set up for us during that time. So it's actually, if we look at all these pictures, and this pictures is also in our hospital corridor, that any people that come and visit, they can view them. So this is a picture of Marian Wells returning from a house call that was done on donkeys at that time, and you can see also, I'm sure it was hot, so she's got an umbrella, with her. So Marion Wells Toms, as I mentioned, she died due to typhoid on 25 April 1905, and she was buried in Bahrain. And if we look at the next slide, some of the first doctors, if we look at this slide, the second head of the hospital was Dr. Stanley Mulria. And if you look at the picture, you look at the steel frame beds, look at the color of the duvets, and you can also see Dr. Stanley Mulria behind the desk writing and doing his documentation after he completed a round. If we look at this screen, it's actually very interesting to see if we look at the amount of nurses and physicians that was in Bahrain in that point in time. This was from 1892 to 1937. So in Bahrain, there was only 5 doctors, 2 dispensaries, 2 hospitals, and there were only 4 nurses and 6 trained assistants that was carrying the burden of all the patients in this area. Next slide, please. Okay, there we look at the nurses, and there in red is the doctors. I just want to give a little bit of information. Although the American Mission Hospital was the first hospital, but not only only the other hospitals. There was another hospital that was started by the British in 1906, the Victoria Memorial Hospital, that was short of funds and staff, and most of their patients was transferred to the Mason Memorial Hospital of AMH. And the Mason Memorial and the Thomas Wells Memorial Hospital was also called by the local as the American Mission Hospital. That is how we became the American Mission Hospital. And soon the Victoria Memorial Hospital was closed in 1948 because they didn't have enough funds or they were short of staff. Next slide, please. So just to come back to the amount to the physicians or the early physicians in Bahrain, this is some of the first female doctors in Bahrain that served in the American Mission from 1910 to 1920. And if we look at it, we can see Dr. Tyra Hildegrand and Dr. Eleanor Tyler, and we've got Lucy Patterson, and we've got Christine Emerson. Next slide, please. So this is the picture of the 1927 hospital, the second hospital that was built. That is the Marion Wells Toms Memorial Hospital for Women and Children that was opened in 1927. And if you come to American Mission today, it is the Zwimmer Clinic building where we do our pre-employment and the treatment for the lower income people. So this building is still visible today. Next slide, please. This is I'm just sharing this interesting slide to say that this is the entrance of the hospital. And if you look closely, this was done, visit in 1936. It was a very significant day where the rulers of Saudi, King Abdulaziz Al Saud and Hakim Sheikh Hamad bin Isa Al Khalifa from Bahrain was together with Dr. Louis Dame of AMH. So they actually came and visited Bahrain, and also people from Bahrain, from Saudi, came to Bahrain for medical treatment, and Dr. Zwimmer and the doctors from Bahrain went to Saudi to treat the people there. Next slide, please. Okay, so now I'm going to discuss a little bit about the nursing pioneers. I've just jotted down their names. So next slide, please. I will start with Amy Walker Zwimmer. She was the first nurse in Bahrain. Actually, she was born in 1865 and she died in 1937. She was born in England, but her family moved to Australia where she studied her nursing degree, and she passed her nursing course from the Prince Alfred Hospital Training School. Deeply inspired by the by an article about the marching orders for some people to come on the mission, she made a decision that she also wants to join the missionaries. So she joined the Christian mission institution as a nurse, and she joined that missionary society, and she worked in many countries. But females that time, when they joined any missionaries, they had to sign a contract to say that they will not get married within a certain period of time. So Amy Wilkins Wimmer was one of them that signed a contract. Then she went to Baghdad with a friend, and there she met a beautiful young American doctor, not other than Samuel Zwimmer, in Baghdad. And I think there was love at first sight from Dr. Zwimmer's side, and he decided that he wants to marry her. But because she signed a contract, it was not possible for them to get married at that point in time. And then Dr. Samuel Zwimmer was so much in love with her that he decided to pay dowry, or to pay the money towards the contract to be able to marry her. So both of them, they got married in Baghdad, and they got married on the 18th of May 1896 in Baghdad. That is exactly 126 years ago by the day, or by one day. And then they went to Bahrain. She worked actually in his dispensary and in the bookshop, where they also met some of the other physicians, and she served for us for many years. Next slide, please. If we see, this is some of her nursing certificates. If you can see, this is the training school, Prince Albert Training School, where she completed a training. This is Amy Wilkins Zwimmer with her husband Samuel Zwimmer, that she met in Baghdad, and this is her first daughter, Katharina. Next slide, please. This is the other children. It is Ruth and Catherine, if you look at the two pictures. And actually, Ruth and Catherine died in Bahrain, and they were buried in the Christian cemetery that is behind AMH Hospital. And they also, the first girls' school in Bahrain was named the Akon School. Today is the Al Raja School, that is just behind AMH as well, and I'm sure all of you know where the school is. And then Amy Wilkins Zwimmer died on 25 January 1937. Next slide, please. Elizabeth de Prieur, she was born in 1867. This is the second pioneer, and she died in 1927. She was a registered nurse, did a training in the Butterworth Training Institution in Michigan in 1898. She was the first single woman who joined the mission. If you can remember that Amy married Dr. Zwimmer, and then she came to Bahrain as a missionary. So Elizabeth de Prieur was the first single woman who joined the mission, but also soon after she arrived, she met Dr. James Canteen, and they got married. So they served many years in Bahrain, Basra, Kuwait, in Oman. And if you look at the stories, I think it was the nurses or the missionaries that came. There was no other people, so they had to marry the physicians. But I'm sure they played a big role in supporting and serving the people of Bahrain. The next slide is from Jane Scarfield. She was born in 1871. She died in 1952. She reached Bahrain in 1903, and she, on her way to, she met an Arabian man named Amin, who escorted her to the mission house on her arrival in Bahrain. She actually stayed for 40 years in Bahrain, and she also worked in many places in Bahrain, Basra and Muscat. And her church donated the first vehicle to the Bahrain hospital that was used as an ambulance and to collect stock. And the medical fort, the vehicle was mentioned, medical fort or the little traveller. And this is a picture of the medical fort name as the little traveller. And as you know, previously, all the transport medium was done either by camels or by donkeys. And today, AMH has got 2 ambulances for transporting patients. Next slide, please. Now I'm talking about Josephine van Peersum. This is also a very interesting missionary. She was actually born in Switzerland and she moved to the USA. She became a registered nurse in a German hospital in New York. Her husband, Reverend Gerrit van Peersum, came to Bahrain and then she had to join him. She was also appointed in 1910 as the superintendent of the nurses in the 1914 in the Bahrain hospital. She served with a lot of passion and she saw a lot of diseases and a lot of people with blindness. So during that time, she observed that there was many people with blindness due to diseases and no medical treatment in Bahrain. Although most of the people were well aware of the unliking scarring associated with the disease, many did not realize that vaccination against smallpox would eliminate one possible cause of blindness. But nowhere it was demonstrated that they were readily available and that the vaccines at that point in time, people didn't believe in the vaccines, as even today we are struggling to get all the people vaccinated. She actually met an interesting person, Aboud Harder. He was an assistant at the Mason Memorial Hospital that was completely blind as a result of the smallpox. However, she took pride in Aboud and she actually, he became an object of pity, and because of his affliction and his duty that he performed, he became a symbol of the great inspiration of all other blind people. She actually studied Braille in Arabic and English, and she was starting to teach the people Braille. Next slide, please. This is actually a picture that you can see of Aboud with his blindness. Dr. Josephine van Peersum was very dedicated, so she taught him Braille in Arabic and English, and he went to the School of Blindness in Jerusalem, there where he learned to do carpentry. He also met his wife Nellie there and they married, and today he's a very successful businessman. He became a businessman that was doing carpentry and he repaired chairs and brooms, and he was making brushes for the people of Bahrain. Next slide, please. Now, the next person that I will talk about is Cornelia Dallenberg. She's also played a very important role in the missionaries and in the history of Bahrain. She was also a registered nurse, although she trained for 3 years in the Westside Hospital in Chicago. She decided in 1921 to join the Arabic Mission. And after intensive Arabic studies, as you know that we cannot communicate with patients, we have to at least know the basic Arabic lessons. She came to Bahrain in 1922 to the Mason Memorial Hospital, and she worked until 1961, nearly 39 years. She also served in a lot of countries, Bahrain, Kuwait, Basra, Muscat, and even in Qatar, she was doing missionary work. Next slide, please. There we can see a picture of Cornelia Dallenberg on her way to Saudi Arabia in 1954. Next slide, please. This is Cornelia Dallenberg in the 1950s on a house call visit with a Bahraini patient. And if you look carefully at the picture, you can see that mostly for the culture of the people. The coffee pot is there. They always serve dates and Arabic coffee to the visitors, and people didn't have beds. They choose to sleep on the carpets or on mattresses on the floor. Cornelia Dallenberg also wrote a book, Sharifa. Next slide, please. Now we're going to talk about the first Bahraini nurse, Fatima al-Zayani. She was actually born in Muharraq in 1980. She got married at a very young age and she had a baby, but unfortunately she lost her daughter due to fever at the early age. Then she decided to join and educate herself at the American school that was now called the Al-Raji School. Next slide, please. Now you can see the previous slide, you can see that Fatima was in a cultural silk dress, the way she worked, and now you can see the picture in a proper nursing uniform. She wanted to become a nurse. She was so passionate about it. She got on-job training at the Mason Well Toms Hospital for Women and Children, so she was trained on the job. Then the hospital leaders decided to invest in her and to send her for a scholarship in Baghdad. She became the first woman to study abroad. She passed her exams in the 1947 in Baghdad. When she came back to Bahrain, she joined the new Naim Hospital. As I mentioned, that this was one of the hospitals together with the American Mission Hospital. She also is the first woman that opened her own pharmacy. The first lady to get a driver's license, and you know now even Saudi now the last 2 years only they can get driver's license. So actually it was an achievement for her to get the driver's license in Bahrain. And then she was a nurse. She was also the nurse in charge for all government schools, and she was working at Salmania Hospital as a director of outpatients of OPD, and she retired in 1971. Next slide, please. Dr. Ida Patterson, this is actually a very interesting story. She was a PhD professor in Virginia. She had a PhD from the Cornell University in the 1930s. She went from the US to Shanghai to the university in China, and while she was on vacation in the USA, she met Dr. Harold Storm, who was visiting the USA from Bahrain at that point in time. Dr. Storm was a widower heading the American Mission Hospital in Bahrain. They agreed to get married, and she went back to the University of Virginia to study nursing, and she passed. So for her from a PhD professor to go back to nursing school and to become a nurse and to come back to help her husband in Bahrain is actually a great achievement. So she is one of the pioneers of the AMH. She arrived with her husband in 1933 and she worked until 1965, where both of them retired in 1965. They were both dynamic and dedicated, that the late Amir Sheikh Isa bin Salman Al Khalifa threw a special banquet for them in the palace for their retirement. And she was able to help her husband also build the new outpatient block of the AMH that was in 1962, that is currently still visible in AMH. Next slide, please. So this is Dr. Ida Patterson Storm with her husband. They left Bahrain in 1965, and this is on the way to the airport that this picture was taken. Next slide, please. Now to come back to the current situation, I'm going to talk about, just to mention, two nurses. This is our own pioneers from Bahrain that served AMH for a long time. One was Amina Gulum. She served the hospital for 45 years, and Cynthia, she stayed in AMH for 42 years. Cynthia was actually a nursing assistant in the American Mission Hospital. She came to Bahrain as a young girl, got married, had her children, and she served our hospital for 42 years. She was a very dedicated, passionate nurse that was serving in different departments of the hospital, and the later tenure was in the OB/GYN clinic. And she was always ready with a smile and a soft touch. Her patients actually loved her. She orientated many of our current nursing staff and frontline staff that came to Bahrain. So any one of them will tell you a fascinating story about Cynthia. And we also got a few more that has left Bahrain. We've got Natella, we've got Maria that stayed here for 27 years. Most of our employees and nurses is staying 15 to 42 years in Bahrain in AMH. So there is something good about our hospital with the passion and the love and the grace and the compassion we serve our community. Now to next slide, please. Now for the conclusion, just one slide back, please. For the conclusion, when we look at the historic pathway of service and dedication from all those that came before us, the golden thread in that their life and their work become their lifestyle. All the small visions of each of those leaders that was realized and achieved become the doorway for others to follow, to do even better and to excel as leaders themselves. Next slide, please. The nursing pioneers inspired us as to set the benchmark for future nurses. They inspired us to become nurses. They enabled the setting of new nursing training facilities, both government and private, that led to improved clinical standards. And in today's nursing profession, we are adapting to the latest health regulatory systems. We are also meeting international nursing standards. We are also following evidence-based practices, and we are now embracing and using digital medical technology, and we're also on our way for a digital transformation in the time period to come. Next slide, please. As the International Nurses Day of 2020 say that nurses are the forefront, leading the trend, following the theme for this year's International Nurses Day slogan, nurses, a voice to lead, invest in nursing and respect rights to secure global health. It's time for us, for nurses, to let our voices be heard. We need to take the lead in the new healthcare setting today, because nurses, there is such a global shortage of nurses globally, and during the past 2 years we were faced with the COVID-19 pandemic that really depleted our nursing workforce and that really made the nurses tired, but it also made us people who knew that nurses became a commodity and they need to support and take care of our nurses. That's why nurses, a voice to lead. Next slide, please. If we look at this slide, we can proudly say that we are NHRA Diamond accredited facility in all 4 sites. We are also the first hospital that has got CAP accredited from the American pathologist. We also certified certification from Bureau Veritas, and I'm very proud to say that we are AHA authorized training center facility in Bahrain, the first private hospital to achieve that for BLS and ACLS. And it was for one of our Bahraini pioneers that made this possible. This is visible in the accreditation currently bestowed to this hospital. Also, one vision always leads to bigger visions. Next slide, please. Now, the King Hamad American Mission Hospital, our new step of the journey, On 26th of June 2019, we started our next chapter as part of our history and our legacy of American Mission Hospital. And our own group CEO, Dr. Cherian, presenting the model of the future hospital of American Mission in the presence of Dr. Miriam De Lama and the King Sheikh Isa bin Khalifa and his entourage. I can just mention that the vision of Dr. George, he actually created this dream, and this dream becomes a reality now. Next slide, please. This is the beginning of the new dream of AMH. There were meetings with the King. When you dream, really, you get big dreams. Exactly what happened when Dr. George had a vision and shared that with everybody he knows. The next meeting was the meeting with King Hamad, the ruler of Bahrain, who understood the vision of Dr. George. That is how his dream became a beautiful reality in its excellent splendor. Next slide, please. If we look to this picture, we can show 120 years of legacy from where we come from, where we are now, and the future. Look at the legacy, and I cannot wait to share with you what we are about to become. Next slide, please. If you look at this picture, in Al Ali, you will be able to see it for yourself. This is the latest current reality. This dream is standing on a solid foundation and slated to open on 26th of January 2023, on the exact birthday of the first American Mission Hospital in Bahrain. We have the existing legacy to stand on and will continue to build on that legacy into the future. It is with excitement that we are looking forward to bring this incredible dream into reality. Next slide, please. This is the finished product that will be inaugurated on 26th of January 2023. Many Olympic champions have said that their medal success was the result of 10 years or more of hard work. But for AMH, the overnight success took 120 years to achieve. In 120 years, old pearl that we are incredibly proud of. I have learned one thing from this, is that no dream and no vision is too small or too big. If it's there to make lives of others better, continue to dream and then work to get that dream alive. Thank you that I could have shared this story and this dream with you. Thank you.
Thank you so much indeed, Elise. It's almost impossible to follow that. What a wonderful presentation, delivered with such passion and commitment, dare I say. And I would now invite our audience to pop any questions they have. We have a few minutes for questions, to pop them in the Q&A function at the top of the screen. And whilst our guests are going to pop in their questions, I would just have one question for you, an observation and a question, if I may, just to get things going, is the common denominator across all of the pioneers from the initiation of the American mission has obviously been, as you've said, Elise, the commitment and the passion to provide healthcare to the people of Bahrain, and have done so for 120 years. And the individual pioneers whom you spoke of were, you know, the commitment in terms of longevity of service is extraordinary, and it still is to this day. And that commitment is, I can speak to it, having attended AMH on different occasions, it's evident within every member of staff that you encounter. What is your secret? What is the American mission secret?
The American mission
Can you
secret
share
is
it?
it's actually lying on our mission and our vision. So our mission is to provide the high quality healthcare at an affordable cost to all who seek care, and to provide that care on our biblical principle, that is compassion, grace, and love. And I'm sure all of the nurses and all of the people in American Mission, you know, we are actually, if I talk about it, I get very passionate about it, so my apology. We are really, we put our patients first, and we are really here to care for the community. And, you know, we are not biased. We treat everybody the same, whether they're rich or poor. We are here to serve the community and to serve the people of Bahrain. And I've also received many compliments for nurses. They say that, you know, the way the nurses is treating the people, we are giving that little bit extra, the tender loving care, that we see the patient as a patient. We don't see him as a disease or as an object. So we really live, all the employees in AMH is so dedicated, and we are led by passion. And that's why we deliver our work by grace, compassion, and love. And that is visible in all what we do.
Well, very definitely, that is true. I'm just taking up one of the questions again, and a point of gratitude from Sumaya, who has asked, is this, the history is so great, is it documented and published anywhere?
Yes, it is documented. It's published. We have got books. We've also in the museum, our birth journals and everything is there. And I can also, I'm proud to say that we've got a whole wall of fame. Yeah. In the old American Mission. There will also be a wall of fame in the new American Mission with all the history and all the pathways. And our group CEO, Julia, she's also busy writing a book. So yeah, I'm sure that soon her book will also be available for everybody to read. So all this history, and even Dr. George and his officers, all the journals from all the medical officers that served Bahrain, documented all the proceedings. And I'm sure Dr. George is also busy with his own documentation of his interview in the past years of American Mission. So all of it is documented for people to follow. And I'm so glad to be part of this legacy of American Mission.
Yeah, and I think that it's fantastic that the strong tradition and history of grace, care and compassion has come through over the 120 years, and undoubtedly will be sustained into the new building, because the building are bricks and mortar, but it's that blend of technology and advancement. We have another question here from one of the participants, and that is, how did the people of Bahrain, do you know, react initially to the medical mission on their arrival? You know, was there any resistance, and what support did they receive from the government to overcome any such resistance if it was evident?
I think if I can go back a little bit, because, you know, these people, there was a lack of medical services in Bahrain, and because of the missionaries, the Dutch Reformed Church of America realized that there is a lot of, you know, diseases in Bahrain and people need medical care. So the Dutch Reformed Church from America was actually the one sending the missionaries to Bahrain, that they not only served Bahrain, but also parts of Saudi Arabia. And even people from Saudi Arabia came. And if you look at the pictures of the hospital since the beginning, that the ruler of Bahrain was well involved in supporting the healthcare that was given by the missionaries of AMH and the people in Bahrain. And until today, when we did the groundbreaking, and, you know, if you see the slides where he was involved, the king is so passionate about American Mission, and he was following us and he's involved in us from the beginning, and is also involving us in the new hospital to come. So I'm sure that the people of Bahrain we are supported by the government, and that's why, you know, we've got the compassion and grace to give back to our community and just, you know, to put our patients and the people of Bahrain first.
How eloquently you've answered the question. It would bring tears to our eyes, to be frank with you, Elise. And I have a comment from Professor Rebecca. What a fantastic presentation, and thank you sincerely. And has a question, which is one which is, I suppose, all on the top of our heads and on top of our tongues, is how do we learn from the history of the AMH, you know, to instill that sense of dedication in our future nurses? You know, how do we translate future?
Maura, I just think that, you know, with all the technology that changes the view of nurses, and, you know, with all the new technology, nurses spend less time with the patients nowadays. They're all on the computer and with paperwork and with technology. But I still think there's nurses and people out there that wants to serve people, and we need those people to join nursing, and we need to embrace them and to give them the opportunity to be part of the nursing workforce. And, you know, as if we've got now global shortage, I think we need to go back to see that a lot of nurses studied nursing because there was nothing else for them to do, but their heart and soul was not really in it. So for now, at least we can, you know, give them that opportunity or inspire them by our ways and means to, you know, to live from the heart. But whatever you do, if your heart is not in anything, you cannot produce what's in the heart will come out. So that's all that I can say. If you're really dedicated to serve people, you become a nurse. Mm-hmm. And we will be there to support and to guide and to lead them and to give them the necessary tools to be passionate and compassionate. We cannot teach people that. It should come from within inside. We can guide them and we can put them on the right path, but at the end, it should come from within.
Yeah, it's that built-in care and compassion.
Yes. And, not all of us can be nurses.
Yeah, I think the challenge also is, following on from Professor Rebecca's question, is in terms of how you sustain that nursing care and the value of nursing against all adversity, because we know right across the world there have been all sorts of, you know, things have gone wrong in healthcare where those who went in with care and compassion and, you know, that culture of really, really wanting to care and give of their best, but a cynicism came in, and that's when we saw obviously you know, the Mid-Staffordshire and the Francis report and that whole push, and indeed in Ireland there were various different scandals as well, where, you know, you really have to, the question was asked, where is that compassion in the care? And that indeed is the challenge. But as you say, it has to be there in the first instance, but we have to be there as leaders to provide that support and nurturing on their journeys.
Yeah, we need to nurture them, and you know, we can guide them to do, you know, to give that excellent patient care. But grace and love and compassion comes from your heart. We can unfortunately not teach, you know, we cannot taught anybody that. But if they come to American Mission, we are all passionate, so maybe soon they will adapt to our passionate and compassion.
I'm sure they will. I am sure they will. I would suspect it's like, you know, it's osmosis as soon as you go in the door, you know. I have one question here as well. Sorry, and that is, it's about the books. Where can we buy these books from? Will the book Sharifa be available in Bahrain?
I'm sure I can, you know, have a chat with our marketing. I'm sure the book will be available here. If we haven't maybe got it, but you know, we can, if they can do inquiries, then we can, I'm sure we can get hold of the book for you.
Okay, that's great. Thank you for that. And actually, there's another question in here from Dr. Iman Tawash, whom you know well, and the leader of the future nurses of Bahrain, and she asks, will the AMH accommodate high school students to work in the hospital to experience the work of nurses?
Yes, for sure we can do that. That will be excellent for us.
Excellent. Well, you can be sure Dr. Iman will follow through on that one for
That
you.
is fine. We welcome volunteers, and yeah.
Yeah, I think it makes a big difference, actually, you know, for those who may be doubting or wondering or have TV images of what nursing is about.
Yeah, at least that we will give them the opportunity to, you know, to know what is the nursing profession about and whether they will like it or not.
Okay, indeed, absolutely, be fantastic. So there you go, Dr. Tawash. You have a volunteer there. I just want to check, have I got all of the questions addressed from the audience here, because we've quite a few participants. Oh yes, there's another comment in from Professor Rebecca, who is asking, we should have more placements opportunities with AMH, and we need to discuss possibilities. You're going to be a busy woman there, Elise, as if you're not busy already. And I can see.
Well, we've got a big hospital. We've got a big hospital to get the stuff ready. So yeah, we can discuss it.
Absolutely, I think that's fantastic, because I know RCSI, we're so proud to be associated with the American mission, where our students are going, and it's just I just hope the synergy, and I'm sure that synergy will continue and grow and strengthen over time. And so, Elise, we're bang on time. Perfect timing. Thank you so much indeed. I wish to thank the audience for everybody who has attended. We've commented. Thank you, Elise, for joining us from Dr. Hussain.
Thank you, Maura. Thank you for having me.
No, it's been an absolute pleasure and an inspiration. So I'd say there may not be a dry eye in the audience. So thank you so much indeed, and we look forward to working with you and the AMH team into the future as we develop and progress nursing for the people of Bahrain. So thank you all ever so much.
Thank you, Maura. Thank you very much.
You
thank you, audience.
Thank you. Very pleasant evening. Thank you so much indeed.
Thank you, Maura. Thanks.